There's something you do many times every clinical day, and do you think about it very much? Not very much. You've all changed to Articaine, we do know that. But have you looked at the differences among needles? There are many, many differences. And when you go in there, where do you put the orifice of that needle where the anesthetic comes out? And are there different angulations on that? I have an expert with us today, Tim Palmer, who is head of science in Clinicians Report. Tim, tell us how you feel about needles.
They've certainly evolved a little bit. They no longer use a standard bevel, but they've gone to a triple bevel system, and this makes the insertion a lot easier, a lot less painful for the patient, and easier to make the injection.
Explain what a triple bevel means.
Well, the standard bevel was when they took and shaved a single plane on the end of the needle. And now they've added additional planes, one on each side. So they describe these as lancet tips, and it allows the tissue to slide past the lumen, so there's not as much catch and drag as it's inserted.
Now, that makes some sense. Can clinicians feel a perceptible difference?
Yes, especially if they're comparing it to the old standard bevel needle, especially a short bevel needle. They will notice much less resistance as they're first penetrating the tissue.
Now, most dentists, as you know, are using a 30 gauge and a 27 gauge needle. And some are bending the needle. In fact, there are techniques out there right now that most of you watching this know, where they're actually bending it at a near right angle. How do you feel about bending injection needles?
A little bit risky to just bend it by hand. You risk causing a fracture in the needle or a weakness that will create a break there. You also might partially occlude the lumen and inhibit the flow of the anesthetic. But those who are doing it get pretty good at it, and they're able to get results.
Yeah, now, as you look at the image we're observing there, you see a very sharp point. What if I go in and purposely hit the bone or inadvertently hit the bone? What does that do to that point?
It very quickly rolls over, creates a burr, much less effective at the penetration after that point.
So what that says, if someone is using the same needle to make numerous different locations of injections, there might be a time to change the needle. Is that right?
There is. There's other designs on the needles as well. Some companies are adding a siliconized layer to make it slide smoother through the tissue. Our investigation of those layers are that they're not very uniform. We have not been able to determine a real significant difference there, but it's a good idea. Other companies use other forms of beveling, particularly the Septoject Evolution needle by Septodont. It uses a triple bevel, but it's done by beveling the front and the back on different angles that create a third chisel-like wedge. Their point is slightly offset, as you see in the image.
This is pretty small stuff. How are they doing this? They must have some special machinery to do it.
They do. And you notice from these images that the needles are actually quite clean, very few burrs, and a very sharp, clean appearance. These all work very well.
Few irregularities. We have tried injecting solution through needles into oranges and other simulated tissue.
We did.
We
tried a variety of membranes, and believe it or not, a standard orange worked best. And it's often used as an analog in training people to do injections. We wanted to see, are some needles easier to push in than others? As you see from this graph, some were a little easier than others. They required less force, although all of them were more similar than different. Their deviations are all overlapping, which shows that they're statistically similar. What you can see, though, is that the larger gauge, the 27 gauge needles, all require just a little bit more force as a group than the smaller gauge, and that would be expected. But overall, these needles are all pretty similar, have excellent designs.
Well, thank you for telling us about it, and you listening and watching. A needle is not a needle. Thanks for being with us. Join us next week.